Immunohematology. It is a branch of hematology that deals with blood banking. So here in the case of immunohematology, they will try to prepare the blood or save the blood for the blood transfusion. So blood transfusion have been carried out since many years back, and it sometimes it resulted in a fruitless experiment or also leading to the disastrous effect. It was only after the discovery of the blood groups that blood transfusion was possible, and the person who had given us a concept of blood grouping was Landsteiner, for which he has received a Nobel Prize. So blood transfusion was possible only after the discovery of the different types of blood groups that person usually have, and it was Landsteiner who was able to give us a concept of the different blood groups. When he mixed his sera with 5 of his friends' blood, he could see in some of the slides that there was no reaction. So he called that blood group as O blood group, and which give agglutination correspondingly called it as A and B respectively. And it was the 4th blood group, that is the AB, that was given by von de Castillo, who was a student of Landsteiner and Sturley. So now we know that there are 4 blood group system, that is ABO blood group system, and based upon this you can carry out the blood transfusion. So it helps us to allow to know the compatibility and incompatibility between individual in carrying out the blood transfusion. Apart from this ABO blood grouping, there are other antigens that can be demonstrated on the RBCs, and thereby different names were given for the different blood groups that were discovered. It was next immediate thing that was discovered in blood grouping was the MNNP classification of blood group by Landsteiner and Levin, and the RH factor, which is another important factor that is usually seen before going for the blood transfusion, is an RH factor that was discovered by Landsteiner and Wiener, who had developed the antibodies against the rhesus monkeys RBC antigen. So these antibodies, when were made to react with the humans, they showed a positive agglutination reaction, which indicated that this RH factor is also present on the human RBCs. So RH is another important component that is usually taken into consideration when going for a blood transfusion. So it was Landsteiner and Wiener who had discovered this in the RH, the rhesus monkey, and hence called this as RH factor. Apart from that, another more amount of or more type of antigen can be expressed on the RBCs in different persons or the individual who have multiple blood transfusion, or is a mother of infant with hemolytic disease. So there are different antigens that can be expressed on the RBCs, and based upon these antigens you can classify the blood groups into different types. So initially it was only ABO RH grouping of the blood. Nowadays we know that there are different antigens that are seen, and based on that there are different names given, such as Levin, KID, etc. So apart from that, there are certain individuals that expresses antigen that are only specific to those individuals. So they are called as private antigens. Now coming to the ABO blood group system, as we all know that it was discovered by Landsteiner. There are 4 blood groups that are present in this: A, B, AB and O. So it is based upon the presence or absence of the antigens that are expressed on the RBCs. The most important are the A and B antigens. So person with the A antigen on the RBCs are called as A blood group, B antigens are called as a B blood group. Without any antigen on its surface, they are called as O antigen, and AB are the one that expresses both A and B antigen. So this type of classification is usually done based upon the antigens that are expressed on the RBCs. Now apart from that, you can also classify the blood groups based upon the antibodies that are present in the serum, which are called as isoantibodies in the serum. So in the individual with A blood group, they usually have anti-B antibodies in their serum, and the person with the B blood group will have anti-A antibodies. body. So these are the isoantibodies that are usually seen in the person with the corresponding blood group. So here the best can be explained with the help of the slide. The group A individual, the red blood cell will have the A antigen. Antibodies in the plasma will be anti-B antibodies, and antigens in the red blood cell is the A antigen. So while going for the blood transfusion, we should keep in mind that the A blood can be transfused only to the B blood, because it is the antibodies that are present in the plasma that can go and interact with the antigen and cause the destruction of the cell, or lead to clumping and causes various types of immunological disorders in the body. So the person with the B blood group will have B antigen, and the person's plasma will have anti-A antibodies. The person with the group AB blood group will have both the antigen that can be expressed on the erythrocytes, but they will not have any type of antibodies. And the person with the O blood group, they do not express any type of antigen on their surface, and they have both type of antibodies. So this is how you can classify the ABO blood grouping system based on the presence or absence of A and B antigen. Now the group A antigen has been recently subgrouped into two, which is A1 and A2, and it is the A1 subgroup individuals that can be seen in more persons. That is 80% of the individual with group A will have A1 subgroup of the blood group, and A2 is only 20% of the individual will have this A2 antigen that can be expressed on the RBCs. Next is we know that it is only the 4 blood groups that were known to us, A, B and O, but after the subgrouping we can increase the 4 phenotypes into the 6 phenotypes. That is, now we can classify the ABO phenotypes into 6. That is A1, A2B, A2B, A1B and O. So there are 6 phenotypes based upon the subgrouping of the group A antigen. Now coming to the inheritance, how these blood groups have inherited from generations to generation is completely based on the Mendel laws, and here in the case of this, the genes that are responsible are called as the allelomorphic genes A, B and O. O is an amorph because it does not express any type of antigen. It is usually seen in every individual, which later on can be modified to produce A and B antigen. So the basic is the H-antigen, from which you get the O, and from O you get the A and B antigen. And the distribution of this blood group varies from one individual to the other individual. It is not that every individual can have all the 4 blood groups. Each individual have only one type of blood group, and when studies are carried out, it was seen that O blood group is most common in the individual, whereas AB is the rarest that can be seen in few of the individuals. And depending upon the antigen, as we have discussed, there are isoantibodies that are present in the serum, and these isoantibodies are called as natural antibodies because they are produced from the genetic factor but not because of the external stimuli. So they are called as natural antibodies. So in corresponding to the group A antigen, you will have anti-B antibodies. So these antibodies are coming from the genetic factor. They are not by any antigenic stimulus. But recently it was proposed that these antibodies can be developed as a cross reaction between the intestinal bacteria, and hence you can see these antibodies that are present in the patient without any antigenic stimulus, because there is no antigenic stimulus that resulted in the production of these isoantibodies. They are naturally produced, and it is a phenomena of cross reaction between the the bacteria that are present in the intestine, and it can be the other environmental sources also that leads to the production of the isoantibodies. And usually the antibodies that are present are of IgM type. So it is the IgM type that can agglutinate at only 4 degrees centigrade and 18 degrees centigrade. At 37 degrees centigrade, these isoantibodies do not agglutinate, and usually the antibodies that are generated against the environmental factors are the IgG types, and these IgG types are produced due to the incompatibility transfusion, and these IgG antibodies are more chronic when compared to the IgM antibodies, which are not usually involved in incompatibility transfusions. Now coming to the immunoiso antibodies, they are ABO incompatible, usually produced during the pregnancies or the transfusions, and they can also be produced by heterologous serum injections such as hot serum or the bacterial vaccines, and usually they are IgG type that can agglutinate at 37 degrees centigrades. Now coming to the H-antigen, from which we get all the different blood groups. It is a common antigen which is a H-antigen that is initially produced. So it is a precursor, you can say, that helps in production of AB and O blood groups. And the amount of H is usually seen more in the group O individual than the AB. And hence group O is more common type of blood group that can be seen, and AB is the rarest group that can be seen. And it is not only secreted by the erythrocytes, but they are also seen in the various secretions such as saliva and the tears. So these individuals which expresses these type of antigen are called as secretors, and they are usually seen in the patients with the alleles or the genes SE, capital SE and small SE, that is a dominant and recessive. Homozygous and heterozygous individual with the capital S and E will are usually called as the secretors, and the recessive SE and SE are usually the one they are called as non-secretors. So secretors are nothing but the individual that secretes more amount of this H antigen, and this H antigen is not only produced by the erythrocytes but are also seen in the other secretions such as saliva and the tears. Next important grouping is the RH blood grouping system, which was again devised by Levin and Statson, who has identified antibodies in the women who had received blood transfusion from the husband, or whose red cells were sensitized by the fetus during the delivery time. So these antibodies are called as anti-RH antibodies. So later on it was studied by Landsteiner and Wiener that on the cells of RBCs there are certain antigen that are expressed which are called as the RH antigen, and they could say it as RH antigen because there was a classic experiment that was carried out where the sheep antiserum towards the rhesus monkey's erythrocyte were treated with the human erythrocytes giving a positive agglutination reaction, which indicated that these RH antigens are also expressed on the erythrocytes of the RBC. So and hence it was because it was seen in the rhesus monkey, and hence the name RH was given to this RH factors. Now there are different theories that were proposed and different classification that was given to state how these RH factor is usually produced inside or produced or expressed on the erythrocyte. So it was Wiener who had given the concept that there are several allelic genes that are present on a single locus, and these single locus these genes are able to produce the agglutinogen and express on the erythrocytes. Next it was Fischer who said that these RH antigens are usually expressed by three pairs of closely linked allelomorphic genes, that is CC, DD and EE, and each individual will possess one pair of this and produces a corresponding antigen towards that can be easily detected with the corresponding antibody. So two theories of RH production was given by Wiener and Fischer. Now the designation was same by both the system, where they has called this RH antigen as a D antigen. So in the kit we can see that in order to identify the blood group we have a kit where we have A antigen, B antigen and the D antigen. So it is a D antigen that helps us to know whether the individual is an RH positive individual or a RH negative individual. So it is the antigen D that is usually expressed on the red cell and can be tested against the anti-D serum test. Apart from the D, there is another important factor that can be seen associated with the RH individual, that is nothing but a DU cells that are, or the DU red cell, the DU antigen that are expressed on the red cells. So these DU antigen cannot agglutinate the RBCs, and hence in order to identify these DU individuals we have to go with the Coombs test. So when the person is with the DU positive is giving is donating a blood, he should be taken as Rh positive. But when he is being transfused, then he has to be considered as Rh negative. So this is usually very important Rh antigen when going for compatibility testing. Otherwise, what happens is when the Rh positive blood is given to the individual with Rh negative, it can elicitate an immune response towards that Rh antigen and cause the destruction of the cells. Next is other blood group systems proposed by different scientists, that is a Lewis blood group system, where it indicates that these antigens such as 11A and 11B antigens can be expressed on the RBCs, and they are usually seen in the plasma and the saliva, and the RBCs usually absorbs these antigen and express this antigen on their surface. So they are similar to the ABO, where you can see the homologous antibodies in the serum. The next type of classification is the MN classification. So here the three types of antigens that are seen on the RBCs, M, N and Mn. Apart from that, next antigen that is seen on the RBCs is the antigen S, and together these MN system has 28 antigen that can be expressed on the erythrocytes. Coming to the clinical importance of each type of blood group system is mostly considered while going for the blood transfusion. So it is a RBO and RH blood grouping that is very important in clinical analysis, and other groups such as the MNP or KIT and DIGO etc. are usually considered when they are going for further studies such as genetics, anthropology or tissue typing or forensic medicine etc. And this can also be used to detect the solve the disputed paternity test. Medical application of blood groups, mostly the first and the foremost important is the blood transfusion. So it was only after the discovery of the blood grouping that we are able to transfuse a compatible blood to the compatible person. So the most important things that are considered while going for the blood transfusion are the ABO and RH antigen. And when you are going for the blood transfusion, certain safety measures have to be taken, and while going for the transfusion, the safety in the blood transfusion that has to be taken care is the recipient plasma. So the person who is receiving the blood should not containing any such antibody that can cause the agglutination of the donor's red cells. Next is the donor plasma. The donor plasma should not contain any such antibodies that can cause agglutination in the recipient cell, causing disaster or a deleterious effect in the recipient body. Next is the donor cell again, which should not express any other type of antigen apart from the blood group antigen, otherwise it can induce an immunological reactions in the recipients. And here the donor and the recipient are based upon the ABO and grouping system, and O group is said to be the universal donor because there are no antigen that are expressed on the surface of the O group antigen, and here they can be given to any blood group. They can be given to A blood group, B blood group or AB blood group because of the absence of any antigen. But sometimes this O blood group is said to be O group because the antibodies that are present, that is usually the A antibodies, are said to cause adverse reaction in the recipient when the blood is being transfused in more amount. So it is large quantity of the transfusion can lead to adverse reaction, and it is the anti-A antibody that is present in the donor's blood group that can be cause deleterious effect in the recipient blood. Next is the AB, which is called as AB blood group, which is called as a universal recipient because of the absence of any antibodies. They can accept the blood from any of the blood group. It can be A, B or O. And usually when going for the transfusion, it is preferred that AB people get blood from the AB, but in the absence of because it is a rare blood group, the person with the A group can also donate blood to the AB blood groups. Next is RH compatibility. So apart from ABO blood grouping, the next important thing that is considered is the RH compatibility. The person with RH negative should not be given an RH positive blood group because it results in immunization and production of antibodies. So initially it may not be defective to the recipient, but in the later part when they are again going for a transfusion with a similar RH positive blood group, they might cause the agglutination and lead to the formation of the immune complex and immunological reaction taking place in the recipient. And the person usually the woman who is Rh negative is more said to be prone to hemolytic disease of the newborn. This mechanism will be discussing in the later part of the slides. Now, while going for the blood transfusion, the test that is usually done is called as a cross matching. Cross matching is nothing but it's divided into two types. One is a major cross match and the other one is a minor cross match. Major cross match is the matching between or the mixing of cells of the donor red cells with the recipient serum. So here, based upon the presence or absence of agglutination, you can go for the compatibility testing. In the minor cross matching, you'll go with the recipient cells with the donor serum. So it is mostly the major cross match that is usually done while going for compatibility testing. And in order to detect the Rh antibodies, this cannot be carried out by the normal ABO testing. You can go with the Coombs test or the Coombs cross match test to detect the Rh antibodies. Next is what happens when an incompatible blood transfusion takes place. So usually because of the incompatible transfusion, there is a reaction between the antigen and antibody between the cells, that is the erythrocytes, and it leads to clumping. Now when the clumps are usually formed in the body, they can go and deposit at any places in our body eliciting the different immunological response towards this antigen and antibody. And the presence of the clumps itself causes very much damage to the human body because they might inhibit the normal functioning of the blood or the circulatory system. So clumping is the most important thing that the first thing that usually takes place when an incompatible blood is being transfused, and it can lead to intravascular hemolysis, and sometimes these clumps can go and coat the antibodies which can enhance the phagocytosis and lead to extravascular lysis. Now the symptoms that are usually seen in the patient who have these incompatible blood transfusion. So first thing is the person starts shivering. Next thing is tingling sensation, an excruciating headache that can be seen in the patient, and precordial discomfort and lumbar pain, leading to hypertension, cold clammy skin, feeble pulse, jaundice, hematuria, oliguria and anuria. Irrespective of whatever it is, whatever the symptom that you can see is immediately you have to withdraw the transfusion that is usually taking place in order to not make the risk more further ahead that causes the damage to the recipient. Apart from the blood transfusion, this incompatible transfusions reaction can also be seen by the immunological process. So it is not only the blood transfusion that can causes different types of disorders. Immunological processes are also related to this type of incompatibility transfusion. So the best thing that can be seen is in the hypersensitivity reaction, trigger and urticaria. So these are the immunological processes that are involved. Next is a common complications which are associated with the blood transfusion is when the blood is not sterile or when it is contaminated with the microorganism, that is the infectious origin. And the blood transfusion, the blood might be contaminated with a variety of organisms such as bacteria, viruses, etc. When it is contaminated with the bacteria and when it is transfused, it can lead to endotoxic shock or a septicemia. And when this blood has the viruses such as HIV and hepatitis, it can cause HIV and hepatitis in the recipient, and very much care have to be taken place with the HIV individual. The HIV individual cannot be screened early in the window period, so it is very necessary for us to go with the sensitization test to detect whether the blood contains any HIV virus or not. So apart from that, hepatitis B surface antigen can also be transferred via this blood transfusion. And next is the cytomegalovirus, which can cause the infectious mononucleosis. So this is the common complication associated with the infectious organisms which can contaminate the blood. So very much care has to be taken to make the blood sterile before giving or taking for the transfusion. Now instead of going with the whole blood being transfused, nowadays we have discovered a new method where only the blood component can be transfused, so which is called as a blood component therapy, and it is associated with fewer complications because we are not using the whole blood over here. We are using only the RBCs. So utilization of the human complete blood is taken, and it can be used to treat anemia with the packed red cells, and it has greater oxygen capacity, and it gives a less circulatory overload, because we are not making use of the whole blood along with the plasma and the other component, but only the RBCs that are required to treat that particular disease or the disorder. So less circulatory overload can be seen, and minimum electrolyte balance is seen in this case of blood component therapy. So if you are using the RBCs, it is a blood component. Now a variation can be done to produce the platelets, or to see make use of the platelet to go for the component therapy. So you can also make use of the frozen red cells or leukocyte and the platelet concentrate. Only the platelets can be given to treat various diseases, mostly the dengue and all. And here the platelet concentrate contain plasma cryoprecipitate and factor 8 to treat the hemophilia. Next, great care again is taken to prevent any type of infectious origin that is taking place in the preparation of this, and maintaining sterile conditions. And sometimes it can lead to adverse reaction, which is related to the autologous blood transfusion. Now coming to the mechanism involved in hemolytic disease of the newborn. So this disease usually seen in the individual or in a woman who is usually Rh negative, and when this Rh negative woman marries a Rh positive male, the first baby that is she is usually bearing will have the dominant gene, that is a Rh positive gene, that is expressed on the erythrocytes of the fetus. So it is not during the whole 9 months that she can be complicated with this. Only during the delivery time there is a possibility that some of the fetus or the baby's blood might enter into the female, that is Rh negative female. Now when this blood enters, it is taken as an antigen, and towards which the Rh antibodies are usually produced. So first delivery is normal. The first baby will escape this fetalis, erythroblastosis fetal. It is upon the subsequent pregnancy where these antibodies that are already produced in the female will go and bind to the Rh positive baby that is being born on the subsequent pregnancy. So this lead to hemolytic anemia, and ultimately leading to the erythroblastosis fetalis. So the antibodies that are produced in the female are the Rh antibodies, and it is the subsequent pregnancy, the second pregnancy, where the disease of the newborn is usually taking place, called as hemolytic anemia or hemolytic diseases of the newborn. Now what are the factors? It is not that every negative woman or the negative Rh negative is related to the hemolytic diseases. So there are certain factors that can overcome this. So first important factor is the immunological unresponsiveness to the Rh antigen, where the person can be a non-responder towards this particular Rh antigen. Next is the feto-maternal ABO incompatibility. Here in the case of feto-maternal ABO incompatibility, the fetus blood while enters into the mother, the ABO incompatible blood group or the antibodies that are present can kill the blood cell before they usually produce the Rh antibody. So incompatibility between the fetus and the mother in the ABO blood group system can also save from the hemolytic diseases of the newborn. Next is the number of pregnancies. As already discussed, the first child usually escapes this hemolytic disease of the newborn. It is only the subsequent child that usually is affected with this newborn disease. And zygosity of the father might express there is a dominant D gene or a recessive D gene. So in case of dominant D gene, the fetus will be Rh positive, but in case of recessive D gene in the father, the child can be a recessive. So in this case also the person can overcome the hemolytic diseases of the newborn. Now how do we detect this Rh antibodies? So Rh antibodies are incomplete antibodies. They cannot be detected very easily. So in order to detect this IgG antibody, you have to go ahead with the Coombs test. So apart from the Coombs test, you can go with the colloidal medium containing 20% bovine serum albumin, red cells that have been tagged with enzymes such as trypsin, pepsins, etc. And next is indirect Coombs test is the best method of choice to detect this anti-RH antibodies. Now coming to the RH incompatibility, how do we identify the RH incompatibility? So in the case of the pregnant woman, antenatal examination is usually done, and first thing is a Coombs test to detect the RH antibodies in the patient or the mother. Next is a high titer of the antibodies are usually expressed. So identifying these high titer of antibodies helps us to know whether the fetus is a RH positive or a RH negative, and identifying or testing the amniotic fluid with the RH positive antigen can also help us to know whether the fetus is an RH positive or an RH negative, and go for the indirect Coombs test to detect the antibodies. And intrauterine transfusion with RH negative blood is usually done to prevent the child from being died due to anemia. So these cells creep in the fetus and they provide more amount of blood so that the baby is not died due to anemia. Next is a premature delivery is usually done in severe cases, followed by the transfusion of the compatible blood. Next is the prevention of RH immunization. Now, how do you prevent the baby from being the hemolytic from the hemolytic diseases of the newborn or the erythroblastosis fetalis? So it is said that as soon as the first delivery is over, the woman is given with an injection which is called as a ROGAM injection, and this contains anti-RH IgG antibodies. Now these injections, the antibodies go and bind to the RH antigen or the blood from the fetus, so they will not induce any immune response. As a result of which there is no antibodies that can be produced in the female, and the second child can be prevented from this hemolytic anemia. So it is the 100 to 300 mg of RH immunoglobulin G are usually given, and it is called as a ROGAM injection. Next is ABO hemolytic disease. So it is not only the RH incompatibility between the mother and the fetus that can cause the erythroblastosis fetalis, but sometimes it can also be associated with the ABO hemolytic. But the symptoms in this are very mild when compared to that of the RH incompatibility. So here the maternal-fetal ABO incompatibility can be seen, and if the mother is A or B antigen, expressing A or B antigen on the erythrocyte will not cause much damage to the baby because they are of IgM antibodies. These IgM antibodies do not cross the placenta, but the female with the O blood group, if she is bearing A or B child, so the IgG antibodies that are present in the O blood group can cross the placenta and cause the lysis of the blood leading to anemia. So it is when compared to the RH incompatibility, this is very milder. And here how do you detect this? With the help of indirect Coombs test, and you can go also for the peripheral blood smears to identify the antigens. Next is blood group and the diseases. It is said that most of the blood groups are related to different types of diseases. Some people with the A blood group are prone to some kind of diseases. They are sensitive to some kind of diseases. Person with the O blood groups are sensitive to some kind of diseases. So there is an association with the blood group and the diseases. So it is usually the leukemia can be seen in the person with the weak blood group antigen. So mostly the person with the weak blood group antigen are more prone to leukemia. Apart from that, when after an infection with the Pseudomonas aeruginosa, the red cells gets changed and they can agglutinate any type of blood. So it is called as Thomson-Frederick phenomena, where the unmasked antigens are usually expressed and these antigens are called as the T antigens. And now after this, the person with systemic bacterial infections are usually more prone to different types of diseases, and they expresses more they express weak antigens on their erythrocytes. Next is the blood group and susceptibility to diseases. Here the person with the O antigen are more prone to duodenal ulcers, and the person with the A blood group are more prone to the cancers of the stomach. So this is what is immunohematology, that helps us to know how it is very important to have a compatibility in the blood group so that a successful transfusion can take place.